Welcome back. So in the last several minutes, we have been looking at time to event data, okay? So we have been looking at counts and rates using Poisson regression. And we said that all of that was to help us set the stage for understanding other methods as well of time to event data. And some of these methods that we'll talk about now are more common in the medical literature. Okay, but to be able to do that, the first thing is to level set on certain categories. Okay, so we all align on what those on what those definitions mean, and then we can take it from there. Okay. First of all, in time to event data, and I said that time to event data is essentially analysis. You create a variable, you create a set of variables where there are two important variables that you're creating. First of all, is how much time did it take for an event to happen? So from the beginning of your study, how much time did it take for a person to die? Maybe this is a cancer patients, so maybe from the time when the cancer patients were diagnosed till the time when they died, or maybe medical students, from how much time from from the time a person starts medical school, how much time did it take to graduate? Okay. Or, you can think about many different types of time to event data that we can use in this type of analysis, right? But it's very important to understand a few things about the time to event data. The first one is the target event, okay? So that is the event that we're talking about. What is this event of interest? If we're thinking about cancer patients and we're following cancer patients until maybe when they become cancer-free or die, right? Then the event of interest is death. Okay. If we're thinking about medical students and we're thinking about the time from when they start medical school until the time when they graduate, okay, the event of interest is graduation from medical school. A key thing to remember about the target event is that the two states must be non-overlapping. That means that a person should not both be in medical school and graduated from medical school, right? That doesn't happen. You are either in medical school as a student or you're not in medical school as a student. So you have to define the event in such a way that they're not overlapping. It's mutually exclusive. You're either here or you're there. Okay. The other thing to think about is a time origin. The time when you start. Okay. The time when you start. More often than not, we want the time to be set. It shouldn't be a shifting time. So it doesn't mean that it has to be the same date on the calendar, but it has to be defined by an event where you enter the state. So either matriculation into medical school is when you define. So from the date when a person gains admission into medical school, you start from counting from there. Or maybe from the beginning of your study, it might be that you're starting your study from the time when the person is diagnosed with hypertension. From that date is a time origin. Okay? The time origin is very critical in defining when the person enters, the states, the first states that you're looking at. And at the time when they transition to another state, okay, that is a target event. When they move from being a medical student to being a medical doctor, that's a target event. The time origin is when they become the medical student. That's when you start counting from. Okay, a lot of people will take maybe 5 years, 6 years, but some people might take longer, right, to become medical doctors. So that is the time of follow-up. And the other important thing that you want to note in defining the time to events data is that the time of follow-up, what's the time scale? Okay, the time scale, it might be in years, okay, or it might be in days, it might be in months, depending on what you're defining. So for instance, you might want to look at, so a lot of infants die in the first year, right? So you might want to look at infant mortality. Maybe you're introducing an intervention at the time of birth, okay, to the parents, and maybe you're teaching them something, you're giving them something to give the child, and you want to see whether some of them survive and some of them die, right? So you might want to count in days. A lot of infants die in the first month, in the first week. So you might want to count in days. So the time scale might be in days or years, but sometimes the time scale is not real time. It might be car mileage. So maybe the question might be, how quickly does, if you buy a new car, how quickly does that car start giving you engine trouble? The date when you buy the new car is a time origin, okay? But the time scale of interest, because if you use the number of years, right? Because as a car is, you're not using it like, two people will use it in different ways, and we have a different way we can think about time of using the car. So we can also use car mileage as a time scale. There's sometimes in research where you have to open your mind to certain things and be less rigid about, depending on the reality of the situation. So in this case, we don't want to use actual days or years. You want to use something else. Here, we're thinking about car mileage. Okay. All right. So let's take an example. So in 2009, you conducted a study among resident doctors, and you asked them about their workload, job satisfaction, income, etc. We've seen this data set. We use it in our labs and SPSS and R. We've seen this many times. Okay. So every year you return to the same group of doctors and ask them if they're still practicing clinical medicine. Okay. If they stop practicing, you ask them when they stop and record the date in month and year. Okay. You record the date in month and year. That means that you're able to calculate the number of months when they switched from practicing clinical medicine. So you generate a data set that looks like this one, okay? So you know that whether they're female or male, you know the number of hours they worked in the week before you started the study, you know the number of calls that they've taken in before the residency, during residency, up to the time when you started the study. But you now keep going back every year, and then you ask them whether they are still practicing clinical medicine. So this year when you go, okay, at the end of the study, you're interested in two things. Did they ever stop practicing clinical medicine? If they ever did, then that means they exited. So you create a variable that says exit. So 0 if they didn't stop, 1 if they stopped. Remember, the event of interest is whether they stopped practicing clinical medicine. Okay, if they didn't stop, you say 0. If they stopped, you say what, you create the variable is 1. But you also ask them, when did they stop? Okay, the time when they stop, you now record that in months. You might record it in days, you might record it in years, right? But in this study, it was recorded in months. Okay, so I want somebody to tell us what the time origin is in this study. Anyone, whether you've spoken today or not. Hello. Yes, hi. The voice is a little low. Nobas, you are speaking. Please go ahead.
Hello?
Yes.
Yeah, the time origin
Mm-hmm.
from the study started in 2009, so I believe that should be the time origin because all the resident doctors were recruited at then. They started yeah.
So the time origin in this study is the time when the study was started. Okay, because that's when you ask them all this information, you started following up. That is the time origin. Someone else wants to tell us what the target event was. The target event. Anyone who hasn't spoken today. Go ahead. Go ahead.
Okay, if they exit from the program or not.
If they exit from the program or not. Okay. So that is the target event. So if they exit from the program, you record 1. If they didn't exit, you record 0. Who wants to tell us what the time scale is? Someone else? Anyone else who hasn't spoken since we came back from this break?
Thank you. Hello.
Yes.
I
We can
think
hear
we
you.
are interested in knowing when they exited, if they exited, and the time that they exited practicing.
Yeah. So what's the time scale? Is it in years, months, or in
It's
days?
in months.
It's in months, exactly. So the time scale is in months. Thank you very much. So let's take another question. In 2012, you conducted a clinical trial to assess the influence of plumpy nuts. I don't know if you guys know plumpy nuts. It's a paste kind of food item that is used to treat malnutrition. Okay, so if you work in emergency situations where there's a lot of people who are developing malnutrition, you have plumpy nuts administered. It's also used in the clinic, for patients who are at risk of malnutrition. So you conducted a clinical trial to assess the influence of plumpy nuts on the risk of death among HIV patients with undernutrition. So you're giving them plumpy nuts to prevent death because you're hoping that you're treating undernutrition, but your outcome of interest is death. Okay. So you assessed patients, you assessed for enrollment into your study at the time of initiating antiretroviral therapy. Okay. So if at that point of initiating antiretroviral therapy, you assess the eligibility if they were undernourished or not. If they're undernourished, then you include them in your study. If they were not undernourished, you kick them out. You say, go on your way. Thank you very much. Continue taking your ART. Okay. If they're undernourished, you include them in your study. So the people who you included in your study, they return to the HIV clinic every month for follow-up. Every month for follow-up. If they missed a visit, you call their phone number, and if it's not going through, you send someone to their home to say, can you go and check what's happening with this person, right? And when they get to their home, for some of them, somebody says, oh, I'm sorry, he died last week. Oh, I'm sorry, he just died yesterday. Oh, I'm sorry, he's in the hospital, but he's fine, right? So you find all that information, and then you ended the study in 2015. At the end of that study, 10% of them had died. This is usual mortality rate in HIV patients. About 10% of HIV patients die every year. Okay. Now, who can tell us the time origin in this study? Anyone else who hasn't spoken today since we came back from the break?
Hello, sir.
Yes.
Good evening.
Good evening.
The time origin is 2012.
Yes, but is it 2012 per se?
Well, I think it should be, we could also have that at the initiation of the antiretroviral
At
therapy.
the initiation of antiretroviral therapy. And the reason why we are making this distinction is that in large studies where you're enrolling maybe 1,000 people, 2,000 people, right? You might start enrolling today, but you might not finish enrolling these patients for 2-3 years, okay?
Yes.
So that means that you cannot always use the calendar year to determine the time origin. You have to use the time when they initiated antiretroviral therapy. I mean, also, even if you're using calendar year, you wouldn't want to think about a patient that you enroll in January as the same as the person you enrolled in December, right?
Okay.
One person has had almost a year of follow-up. So you want to think about the time of initiating antiretroviral therapy as the time of initiation. So you can then think about the time scale in a different way. All right, thank you. Somebody else tell us what the target event is. The target event. I think I saw a hand that came up earlier.
Dead.
Go ahead. Yeah.
Dead. How do you explain it?
We can hear you speaking, Utsunaya, but we can't hear what you said. What's the target event?
Dead.
Death. Okay.
Dead.
All right. Death. Excellent. Thank you. I saw someone else who unmuted themselves. Can you tell us what the time scale is? Here, you might be a little more creative, right? What would you use as the time scale if you were conducting this study? Yes, Sato, do you want to speak? We can't hear you. I think you've unmuted yourself. Anyone else?
Hello.
Yes. Go ahead.
I will feel it would be better to use days, because months, somebody can die even before coming up to a month in the study.
So yeah,
days may be better.
This might be better. Okay. That's an excellent argument. Yes, someone might die in between, and even if you use months, right? I mean, so it's days is better, and you can use months, but you can allow the months to be a decimal, right? That means that if they die in the middle of the study, you can sort of estimate, was it like, you can use the days to calculate the month. So what we often do is that we capture the exact date, and then we use the date to calculate the month, because if you're going to present it on a graph, like if you're going to use days, it becomes complicated, right? But if you use months, then it's easier to do. Okay. All right. So the time scale might be days, right? Like you capture the days, but you might present it in months. So that's acceptable too. So it's important to understand. There's one more question before we move on. And the reason why we keep going over, this is the most important part of this class today. You have to be able to engage with the literature that you read and be able to interpret it, because that's going to be the basis for even understanding which methods you want to use. All right, so in 2000, you conducted a cohort study to assess the influence of bed net use. Okay, that's the exposure, bed net use, on the risk of a spontaneous abortion, fetal death, stillbirth, or infant death. Okay, either of all these four in the first 6 weeks. So infant death in the first 6 weeks. So you're looking at, you're following up pregnant women. Pregnant women are assessed for enrollment into your study at the time of starting antenatal care. Okay. So if they met eligibility, whatever your eligibility criteria was, then you gave some people bed nets. You didn't give some people bed nets. That's not ethical, by the way, but this was in 2000 and we didn't know that bed nets worked, maybe. So you gave some people bed nets, and then you didn't give some people, and you followed them up every month. Okay. They came to ANC, I asked them how they were doing, and then the outcomes that we were looking at were what? Spontaneous abortion, fetal death, stillbirth, or infant death. Any of them, any of them, either. So what's the time origin in this study? I see that someone is unmuted. Nyasato, I think you're unmuted. You want to take it? If you're speaking, I can't hear you.
Yes.
Yes, go ahead.
Good evening.
What is the time origin?
I think when a pregnant woman is enrolled for ANC.
When they're enrolled, exactly. So when they start, when are they enrolled? When they're starting antenatal care. Very good. Thank you very much. Someone else wants to tell us the target events.
Hello. I think, can I take it?
Okay, you're spoke up.
Okay, I think it's spontaneous abortion, fetal death, stillbirth, or infant death within the first 6 weeks. That's what they want.
Yes. So any of them, if a person experiences one, so you have to think about the fact that the way that these outcomes are, you cannot experience this too. I mean, and that's just the way it is here. It doesn't have to be. So it's either a person has a spontaneous abortion, or they have a fetal death, or stillbirth, or infant death, or the child is alive and well and goes and is alive beyond 6 weeks. Okay, so that's the target event. So what's the time scale that you would like to use here? Someone is unmuted, so maybe you should take it.
The time scale I would like to use here is in weeks.
Is in weeks. Why would you like to use weeks?
Because initially it's monthly that they come for follow-up, but until delivery, and then add the 6 weeks, which is a smaller and easier way of representing the time scale.
Yeah.
Because if you use months, what if somebody comes the baby dies on the 6th week? So at what month is that? It's not measurable in, except if you want to put 2.5 months or 1.5 months. So I think weeks will be
better. Yeah. I mean, so that's okay. So weeks make sense again, because in pregnancy we are often thinking about pregnancy in gestational age in weeks. So more often than not, if you look in the records of the patient, you will see weeks. You can also use days here as well, right? Like we said, because that gives you finer capturing of the data in this case. Excellent. So let's move forward. So sometimes when people conduct a study, we talked about the time origin, that the person has to be in the state. You define it. This is when they start. But this is when they start antiretroviral therapy. This is when they enroll for pregnancy. Okay, but sometimes, because of the nature of your study, right, you start counting the clock from a period when people could not have had the outcome. Or if they had the outcome, you could not have measured it. Okay, let me give you an example. You are interested in AIDS-related death. Okay, AIDS-related death. So that means that the person has to have been HIV positive, then had to have developed AIDS, and then died. So you see multiple things. But maybe the intervention that you're interested in is the prevention of HIV infection. You see what I mean? The intervention you're interested in will work through preventing HIV infection in the first place. In that case, right, you might not know exactly when they became HIV infected. Even the patient might not know themselves, right? In that case, you just, you're going to start counting the clock at a time when you have information for. But that time might not be correct. Okay? And so you guess as best as possible, but there's going to be some person time, some period that's not covered by your study, when the person might already have been eligible. So maybe you might guess and say this time, right? So that's a form of bias. And that's a form of bias that is unique to time to event data. Okay, so let's take another example. You want to start, so you're interested in teenage pregnancy among secondary school girls. Because you're focusing on secondary school girls, you start counting the clock from the date when they enter secondary school. But you have to note that at the time when they enter secondary school, some girls will not have attained puberty. That means that even if they had sex, they were not going to become pregnant. Right? Now, in that period when they could not have become pregnant, but that period that you're including in your study because it's convenient for you to just look at the date of entry into secondary school, that period is called an immortal person time. Okay, and it's a form of bias that you're introducing into your study. Okay, so you might ask, why don't people just start the clock at the right time? But that's, like I said, it's because they might not know. Like, you might not know when a person actually does start puberty. So even if you know when they started puberty, what would you use when they started menses? But the time when they start menses is already like they've already started having maybe secondary sexual features before then. So like, how do you define? And the person might not even remember. So you will have some period that's covered in your study that the outcome could not have happened. And that's a form of bias. So the reason why we're talking about this is that you always have to remember that as best as possible, okay, the period that you're covering in your study, it should be possible for the person to experience the outcome. All right, so that's immortal person bias. It happens sometimes. And before we go, so let's keep going. All right, now let me talk about censoring. If you start following people today in your study, so this is a schematic that's commonly used for like in longitudinal studies. This is the date, this is the time origin when the study opens, okay? This is the time origin. And you follow each person from the time when the study starts. For this person, this is the first patient that you enroll them that day, right? And you see whether they experience the event. And then maybe a week later, you enroll another patient. This is their own time origin. Maybe this is when they start their antiretroviral therapy. This is their own time origin, and you follow them until they experience the event. But there are for some people who never experience the event, which happens commonly. If you think about the experience of AIDS-related death, some HIV patients never experience AIDS-related death, right? So those people, you follow them until it's time for the researcher to close the study. Maybe they run out of money, or this is the scheduled time when they say, oh, we're going to do this study for 3 years. So at 3 years, you draw a line in the sand and say, studies ended, you celebrate, okay? At that time when the study ends, anybody who is still in the study, right, you record 0 for them and say they did not have the event. The people that had the event before you got to that 0, you record 1 for them and say they had the event. Okay? Now, some people during the study, you stop seeing them, they stop coming. Right? So maybe it's an HIV patient in that HIV study we talked about, and they stop coming to the clinic. The outcome of interest is death, but you just can't find them. You go to you call the phone numbers that they gave you, it's not going through. You go to their home, the address that they gave you, you don't find them there. You ask their neighbors, they say, oh, we don't know where he is. He hasn't come home in 2 years, or in a month, in 2 weeks, right? And you never see them again until you close your study. That person, you do not know whether they experienced the event, right? And so you record 0 for them. But because you don't know whether they experienced the event or not, this is called censoring. Okay? Because you don't know whether they experienced the event or not, this is called what? Censoring. So you have to kind of bear that in mind that, oh, we don't know what happened to this person. But even the person that, you know, I said that there are some people that when you close the study, they had not had the event at that time. It is possible that they may never have the event. That's possible. But it's possible that maybe they had the event a week after you close the study. Because you have closed the study, you don't go back and add it into your information. Okay? You don't go back and add it into your information. You just say, oh, they didn't have, we don't know whether they had the event while the study was ongoing. That is also called censoring. Because at the time when you close the study, you didn't know whether they had the event or not. But this is called administrative censoring because it's based on when you decide to close the study. All right. So sometimes, okay, a person, you know, had the event before they joined your study. Right. So this person that you thought never had the event, maybe they already had that event. It might be that you're thinking about the time to COVID-19, to having a COVID-19 infection. COVID-19 is spreading like wildfire in many places now. And your study is looking at if a person eats an egg every day. That's your exposure, and you're interested in seeing whether eating an egg every day prevents COVID-19 infection. You might inadvertently, and assuming that a person can only have COVID-19 one time. You might inadvertently include some people before you start the study who have had the event. And so when you follow them, they never have the event. You never find out that they have the event, but that's because they already had it before they started and you didn't check carefully. That's a form of censoring. And that's called left censoring because it's on the left of the study before you start. But this person that had the event after, right? After this person that you think could have the event after, that's called right censoring. Okay. So this censoring
Can I
is
take that
really
again?
all right. Let me take that again. All right. So you have this schema of the study. The study opens, you follow them up. Some people have the event, you record one. Some people never have the event during the study. And but at the end of your study, you roll the line in the sand and you say they are censored. And we said that is called administrative censoring because it's based on it's based on you drawing the line in the sand. Now, some people have the event on the left of this line before you can even find out. And this is important in cases where they have the event, they can be in your study, but you will never find out that they've had the event and they cannot have the event again. And that happens a lot in like viral infections, for instance, where they've already experienced the event and they're not going to experience it again. That is called left censoring. Okay. But sometimes a person is censored after the study opens. Okay. And that is called right censoring. Some of that is during the study, but some of that is also after you've done your administrative censoring, but you don't know exactly when they have the event. I hope that's clear. Ibua, do you have any thoughts on this at this point?
Maybe to reiterate something you said about I believe left censoring.
Okay.
But someone has a question and wants you to explain immortal time. What you call
Present time. Yes, I will go back to it. I just wanted us to get through this quickly.
Okay, so one of the things that in terms of censoring on the left, you may not be able to tell whether people have received the outcome before they are enrolled in the study. In some cases,
Yep.
maybe people have like cancer or people who may have had a TIA and you're looking at, what do you call it? If you're looking at cerebrovascular accidents, although a TIA is not the same as a stroke, it really is kind of the outcome you're looking for. So that's one of the issues with your left censoring. If you don't do that, that immortal or immune time thing, if you're unable to do that, and that left censoring can introduce some bias into your study because you choose like a cutoff,
right,
from which to begin your study. Yeah.
So as best as possible, you want to check to see whether the outcome has happened at the time of starting the study. So that means that if it's a TIA, for instance, you're asking the patient carefully about the symptoms, right? If there's imaging that you can do to examine whether the outcome has already happened, and so what you're going to do varies from study to study, right? But it's essentially the same understanding that sometimes the outcome has happened before, right? And you will, by introducing the person, you might not see that outcome happen again. But you're you're introducing them into your study, and that creates a form of bias. Okay. All right. So let me go back to immortal person time very quickly. So immortal person time, I think the better example is this puberty. Okay. I find that to be easier to grasp. At this, you start your study. When you're starting your study, right, you might just go to the school and say that all secondary school girls, you're looking at, the study is looking at teenage pregnancy among secondary school girls. But at the time when you start the study, some girls may not have attained puberty. The reason why you're looking at all secondary school girls is just for your own convenience. Also because you think that if you ask them when they attain puberty, they might not know, right? So you might not get correct information. So you want something that's clean, it's uniform across the board. So you say at the date of entry into secondary school. But you know that some people have not attained puberty before, while in their early years in secondary school. Some people might take maybe 5 years into secondary school before they attain puberty, right? Some people, they might already have attained puberty before they start. So that period when a person could not have been pregnant because they have not attained puberty, that is immune person time or immortal person time. It's immortal person time if you're dealing with death, but it's immune person time if it's anything else. Okay. So that period, because they could not have had the outcome of interest, that is immune person time. It creates a form of bias, and it could affect the results, in any direction, depending on details of the case. All right. So that is immune person time. So let's keep going.